Welcome to the Automated External Defibrillator, or AED, training. Let's take a look at what an AED actually is. It's used to help those who are experiencing sudden cardiac arrest. It's an easy-to-use medical device that can analyze the heart's rhythm, and when necessary, it will deliver an electrical shock to help the heart restart an effective rhythm. The stated mission of the American Red Cross's National AED Training Program is to promote and encourage public access to AEDs, supporting the responders in the event of a sudden cardiac arrest. With this in mind, the American Red Cross assembled a task force and worked to ensure that each of our direct patient care facilities have an AED present, updated, and available for use. Any direct patient care facility that does not currently have an AED installed will be receiving the Heartsine SAM 350P. This is a simple and user-friendly device. Its easy to understand visual and voice prompts will guide the rescuer through the entire resuscitation process, which will include CPR. It's a simple, straightforward operation with just an on and an off button. The Heartsine SAM 350P also has a self-monitoring LifeLink Central program manager, which will monitor each AED connection to a Wi-Fi network and alert you to anything that may affect the device's readiness, and this is all done automatically. Let's have a look at some of the functions of the SAM 350P. Up at the top, you have the data port, the attached pads icon and action arrows, and the status indicator. Towards the middle of the device, which you see shaped as a heart, you have the shock button. To the right of that, you can see the safe to touch icon and action arrows. Underneath that is the green on and off button. Just under the on and off button is the speaker. To the bottom of the machine, you can see the green tab and the pad pack. On the left side, you can see the adult and pediatric symbols, which indicate that the SAM 350P is compatible with both the pad pack and the pediatric pack. Lastly, underneath that symbol, you have the do not touch action arrows. Do not touch the patient when the action arrows above this icon are flashing. We'll get more information on the device when we watch the short video demonstrating its use. A few minutes ago, you all heard me reference LifeLink Central as well as AED program managers. I want to talk a bit more in detail about that now. Not only will facilities be receiving the Heartsine SAM 350P AED device, but you'll also receive the Heartsine Gateway. The Heartsine Gateway is a separate piece of equipment that will attach to your AED device. This will allow for self-monitoring of the AED machine. It will perform a data upload every 7 days. It will also perform a manual upload to LifeLink Central anytime that the power button is pressed on the AED machine. In addition, anytime the power button is pressed, it will perform a self-test of the AED device, and the results will be automatically uploaded to LifeLink Central. Your safety and facility departments will take on the role as the AED program manager, and they will be monitoring LifeLink Central to ensure that your device is properly maintained and in good working condition. We're going to end this training with a video that was designed by the manufacturer that's going to show an example of how to use the AED machine.
You have just installed the 2010 guideline-compliant Heartsine Samaritan PAD. Now let's look at how to use one in a life-saving situation.
Are you all right?
Get the Samaritan PAD as quickly as possible.
Go call 911. Go get the AED.
Press the green on button. The device will automatically identify an adult or pediatric patient based on which pad pack has been inserted.
Adult patient, call for medical assistance.
Did you call 911?
Remove clothing from patient's chest to expose bare skin. Pull green tab to remove pads. Peel pads from liner. Apply pads to patient's bare chest as shown in picture. Press pads firmly to patient's bare skin.
The Samaritan PAD automatically assesses the patient's heart rhythm.
Assessing heart rhythm. Do not touch the patient. Stand clear of patient.
And recommends whether or not a shock should be delivered.
Shock advised. Stand clear of patient.
Everybody
Press the
clear?
orange shock button now. Shock delivered. Begin CPR. It is safe to touch the patient. Place overlapping hands in middle of chest. Press directly down on the chest, in time with metronome. Remain calm.
The combination of CPR and defibrillation is the best rescue technique you can practice until medical professionals arrive on the scene. Sometimes, no shock is needed in a life-saving situation, and the Samaritan PAD will tell you if that is the case in that instance. If CPR is needed, it's important to apply effective chest compressions for 2 minutes. The devices will provide CPR coaching on how to cross your hands, where to place them, and will include a metronome beat that will coach you on how many compressions to apply per minute. The 2010 AHA guidelines for CPR and ECC once again emphasize the need for high-quality CPR, including a compression rate of at least 100 beats per minute, a change from approximately 100 beats per minute, a compression depth of at least 2 inches or 5 centimeters in adults and children, and approximately 1.5 inches or 4 centimeters in infants.
Stop CPR. Assessing heart rhythm. Do not touch the patient. Stand clear of patient. Shock advised. Stand clear of patient.
Everybody
Press the
clear?
orange shock button now. Shock delivered.
You're okay.
One note for rescuers: the Samaritan PAD can be used while in its protective case or out of it. After using the Samaritan PAD, contact your Heartsine channel partner to purchase a replacement pad pack. Slide a new pad pack into the unit and store it as usual. Remember to follow your local battery disposal guidelines. Periodically, check that the green light is flashing so that you know the unit is ready in case of an emergency. The Samaritan PAD stores up to 90 minutes of heart rate information after use. Use the data cable to download the event data for a physician who may want the information from the device to formulate treatment decisions. The data cable is available from your authorized Heartsine channel partner. After downloading the event data, please erase the data from memory. If you need assistance to do this, contact Heartsine Technical Service. With little or no training, rescuers of any skill level can confidently use Heartsine Samaritan PAD's life-saving technology. With the unit nearby, you are always prepared to respond in the event of someone going into sudden cardiac arrest. Heartsine. Life-saving, pure and simple.